Hello! Good morning, good afternoon, good evening to our followers on our social media accounts. Of course, Jing Castaneda and Salamat Doc Facebook pages. I'm Mommy Jing Castaneda, and again, we're going live on our Facebook page. Katatapos lang po namin sa Salamat Doc Channel 2, and as always from Channel 2, dito naman tayo pupunta sa ating Facebook Live. Uy, welcome also sa ABS-CBN YouTube followers natin. Ayan. So ito pong ating ginagawa ay para tuloy-tuloy pa rin yung pagbibigay ng ating impormasyong medikal, impormasyong pangkalusugan na napakahalaga po sa kahit saang pamilya. So ang mga bisita po natin ngayon ay mga eksperto pagdating sa cancer. Sila po ang ating mga katuwang mula sa Fuda Cancer Institute. Okay? Pakilala na kayo. Doc Mike, Doc Mo. Sige, go.
Ako si Dr. Michael Hernandez, isang general and cancer surgeon based po dito sa Pilipinas at connected po sa ilang mga medical center po dito sa Maynila. Okay? Isa po rin katuwang nila ng FUDA sa mga pasyenteng mga Pilipino na nanggagaling po sa China.
Okay. Dr. Mu, go ahead.
Hello, good morning. I'm Dr. Mu from China. I'm an oncology surgeon and interventional therapist. So we do the ablation for the cancer, especially we do the cryoablation and the nanoknife ablation for the solid cancer in lung, in liver, and in pancreas.
So yung kanila pong teknolohiya ay makabago, tama ba Doc Mike? Makabagong teknolohiya at ang kanila pong specialization ay yung mga kaso na medyo hirap ng matugunan, no, dito sa Pilipinas. Tama ba, Doc?
Okay. Merong mga bagong kagagamitan at teknolohiya ang FUDA Cancer Hospital na may offer natin sa mga pasyenteng may cancer na hindi pa available sa Pilipinas. Okay. At
tulad ng?
Kagaya ng cryosurgery. Okay, marami na ginagamit nila sa mga cancer sa lungs, sa liver, sa prostate, any solid tumor, okay? Ay tungkol na cryosurgery, meron din silang nanoknife, gamma knife, and then maganda rin sa kanila yung kanilang mga immunotherapy at localized chemotherapy. At isa rin ay yung mga malalaking mga bukol, malalaking tumor na cancer na hirap nang tanggalin, sa kanila natatanggal nila kasi marami silang kasong. Kasi alam niyo naman po ang operasyon sa cancer, yan po ay technique yan eh. Kung marami ka nagagawa, so malaki na magiging eksperto ka ng maraming success rate. So sa kanila, since alam na po natin ang dami ng mga Chinese population nila, billions. So marami sila nakikita mga gitong kaso at malaki yung experience nila removing huge tumor.
Okay. So Doc, maybe Dr. Mu can explain what cryotherapy is?
Yeah, cryotherapy is a minimally invasive procedure invented by USA and also approved by USA and the Chinese FDA. And we use this procedure. When we use this, we insert the probe inside the tumor and freeze the tumor under the temperature minus 170 degrees Celsius. So during this freezing, the cancer cells cannot survive under this temperature. So that's why we can destroy the cancer without open surgery, especially for those solid cancer in liver, in lung, in pancreas, in prostate, in kidney, and also in the urinary bladder.
Okay.
So it can cover many kind of cancers. Yeah.
Is there cryotherapy in the Philippines?
Wala akong
Wala pang cryotherapy sa atin. Okay. Nanoknife. What is nanoknife?
Nanoknife is another technique, very new. It was approved by US FDA in 2014. And in 2015, Chinese FDA also approved this technique for liver cancer and pancreatic cancer, because this technique use very high voltage to make some hole on the surface of the cancer cells. So this is also called irreversible electroporation, IRE. This is a technique also invented by US and now it mainly focus on the pancreatic cancer and liver cancer.
Okay.
Yeah.
So there's also no nanoknife, Doc Mike, in the Philippines? Wala. Wala pang nanoknife. Okay. Ano pa yung ibang mga makabagong mga paraan?
Okay. Meron ngayon silang kinukuha na gene sequencing test. New generation gene sequencing test. Okay. Ito yung pag-examine sa cancer at aaralin kung saan nagkaroon ng mutation yung gene ng cancer.
Bakit importante yun, Doc?
Importante ito para malaman natin kung anong klaseng gamot ay bibigay sa kanya.
So iba pala ang gamot sa iba't ibang kaso.
Yes. Dati ang pinagkukuha natin gamutan like chemotherapy ay protocol. Kunyari, based on this kind of protocol, these cancers nagre-respond. But with the gene sequencing test, specific
oo.
yung kanyang gamot for the specific type of cancer.
Okay. So, hindi pala yun one size fits all, Doc, no? Kasi
Yeah,
akala ng iba, ay pag cancer, chemo, radiation. So, hindi ganun
Hindi.
ka.
Kasi kailangan i-tailored natin or customize natin ang treatment for cancer.
Okay.
Unang-una, magkakaiba ang pasyente. Okay. Pangalawa, iba-iba response ng tumor
Tama.
sa iba't ibang gamutan. So, hindi pwede na ito ay effective kay patient A, it will be effective in patient B.
Okay.
We have to individualize the treatment.
And you can do that by coming up with a test on the gene sequencing, on the mutation of the genes.
Yes. Obama, the president of USA, announced now it is the time of precision medicine. So how to do the precision medicine? It will based on the genetic test, because the gene determine the characteristics of the cancer. Now we divided the cancers not according to the original organ, but according to their gene background.
Gene mutation.
Yeah, the gene
Genetic
mutation and deletion, some changes.
Wow.
And now we have many targeted medicine which can target the molecule in the cancer cell, so that we can use this kind of targeted medicine to treat those kind of cancer. And there are many progress in this. In this year, the ASCO, the American Conference of Oncology, also report many improvement of the targeted medicine and also the development of the immunotherapy. And using this precision medicine, the next generation sequencing of gene, we can select the sensitive medicine, including immunotherapy, including targeted medicine, or even we can choose the sensitive chemo medicine. And from the genetic background, we can know whether the patient will have a strong side effect if they receive which kind of chemo medicine.
Okay.
So it can guide us to choose
Correct,
the effective
correct,
medicine,
correct.
useful medicine.
Okay, so we'll go to the questions, Doc Mike, Doc Mu. Hold on. Okay, here. These questions are from the following. Beth Venus. Ang tatay ko po ay na-diagnose na may liver cirrhosis. Malala na po ito, cancer na raw po ito. Kailangan na raw po niyang magpa-chemotherapy. Ano pong maire-recommenda ninyo? So may cirrhosis of the liver, yung patient.
Okay. Sabi sa tanong is cirrhosis at minamention na cancer. Okay.
Ano ba yung liver?
Okay.
Ano yung cirrhosis?
Ang liver cirrhosis ay, imagine mo, isang puno na inanay, natuyot, lumiit, nagbukol-bukol, parang natuyo. Okay. Yun ang pinagsimulaan para magkaroon ng cancer of the liver. Ngayon, anong dahilan at nagkaroon siya ng cirrhosis? Maraming bagay. Chronic infection, hepatitis B, okay. Fatty liver, yung pagkain natin ng mataba, yung ating pag-inom ng alak, sisira, pag-inom ng mga gamot, kaya cirrhosis. At susunod dyan, pagkain natin ng mga pagkain na may mga amag, yung tinatawag ka na namin aflatoxin.
Meron pala yung doc effect pag kumakain ka na may amag.
Meron certain amag lang, yung tinatawag na naninirahan ito sa mga peanuts, cereals, corn, rice, lentils, na common ito sa atin sa Pilipinas dahil mainit tayo, humid. So yung mga amag is nabubuhay sa ganung weather, sa ganung temperature. So pag malagi ka nakakakain ng ganon, it can cause to a liver cancer. So mapunta tayo, cancer of the liver. Anong pwedeng gamutan sa kanya? Ang una is, tatanungin natin, kanong kalaki yung bukol? Ilan yung bukol? At kaya ba yung kondisyon ng pasyente? Okay, kung meron pa
So
siya
hindi rin automatic. The nanoknife cryotherapy, they're not the automatic treatment that's going to be used for
Yes.
instance, in this case, no?
Yes, depende yan sa,
Liver cirrhosis.
first of all is the general condition of the patient.
Okay.
Susunod, kanong kalaki yung cancer mo. Kung more than 5 centimeters already, the tumor mo, baka mahirapan, baka mag-session sila. Tapos marami pala sila din. So we cannot kill all of them.
Okay.
So,
Next, Linalyn Alvis. Lumalaki po yung leg ng nanay ko, cancerous daw po. Gusto pong magpa-second opinion. Ano pong pwede namin gawin? Okay. So for those who are watching us and they want to seek your opinion, your advice, where do they go? What do they do?
Okay. Kung meron po kayong mga questions or gusto nyo mag-seek o kumonsulta ng second opinion regarding sa mga bukol ninyo, whether ito po ay cancer na o hindi cancer, mas maganda sana ho kung meron na tayong biopsy at cancer. Pwede po kayong pumunta sa Centuria Makati, room 901, at para avail kayo ng libreng second-hand information or consultation.
So libre yun, Doc.
Libre po yun.
Libre yung consultation.
Sa
Yung
ngayon,
mga tests, biopsy, yung mga tests, libre
wala
ba?
hindi po gumagawa ng test sila.
Okay.
Mas maganda sana dala nyo na po yung test.
So sa iba sila magpapa-test, magpapa-biopsy, dalhin yung result.
Tapos i-evaluate po kayo if you are a candidate for treatment sa China o sa FUDA. Kung sasabihin naman po nila kaya dito sa Pilipinas yan, sasabihin na po naman nila, kaya naman dito sa Pilipinas yan, dito ka na lang magpagamot.
Okay. Paano mas mura ba, Doc? Ganun ba yon?
Well, in a way, pero sabi nga nila, kung kaya mo magpagamot sa malalaking ospital, malaking medical center sa Maynila, you can also, kaya mo rin.
Dahil ang gastos ay
Pareho.
Okay. Next, Josie Castillo, meron po akong kilalang may stage 4 liver cancer. May procedure po bang makatutulong sa kanya? So, Doc, again, they have to go to you, no? And bring all the results and avail of the free consultation because as you mentioned, there's no one-size-fits-all treatment. You need to do an analysis of each and every patient.
You mean do other treatment?
To avail of your treatment.
Yes, stage 4 liver cancer. First, the treatment should depend on the liver function.
Yes.
And also the hepatitis. If the hepatitis is active, then the patient need to receive some antiviral medicine to control the virus activity.
Okay.
At the same time, of course, we need to delay the progress of the liver cancer. In stage 4, it depends how many lesions the patient have. If there are only a few lesions in liver and 1 or 2 lesions in lung or lymph node, we still can do cryoablation to ablate to control those lesions. But at the same time, because this is a palliative procedure because patient is in stage 4, so we also can give the patient some targeted medicine. Now the popular targeted medicine is sorafenib, regorafenib, and lematinib. Here, I think in Manila, they can also find lematinib and Levima.
So Von Hihada has a more or less similar question, asking for a treatment for his wife who has cervical cancer. So again, Doc, I think they're looking for a general treatment protocol of sorts. So as we mentioned, we cannot have a one-size-fits-all recommendation. You really have to see the patient. They have to go to you. Yes,
of course, we need to know the staging of the disease, the cervical cancer. Routinely, the patient need to undergo the radiation, and if possible, patient can receive the concomitant chemotherapy. And after that, if the patient have some recurrence in cervix, then we can do the iodine seed brachytherapy, because many cases will have a recurrence after the radiation. So in this situation, we can do the iodine seed brachytherapy to increase the dosage of radiation to control this tumor more effectively. And now, because the NGS progress, we can find some targeted medicine, especially for those kind of woman cancer. They have BACR1 genes, and this gene, if this gene is positive, there are some targeted medicine which can prolong patient's life.
Okay. So again, Doc, your contact information, please, for our followers.
Contact information. So, I don't have the number, but you can call. You can search sa Facebook, Fuda Cancer Hospital Satellite Clinic in 901 Centuria Makati, Medical Makati, in Salamanca Street. And then you can avail of the free consultation. Dr. Mu will be here up to Thursday morning to do the free consultation. If Dr. Mu is not here, our liaison officer, Mr. Segundo Cruz, is always there, and he will entertain you, gather some data, probably send your data to China for evaluation, and then come up here with a solution, with a suggestion. Okay, the telephone number is 0917-775-3426, 0917-775. That's it, and that's it for Dr. Mu. But first, you search for the Facebook or internet, Fuda Cancer Hospital and the satellite clinic.
Dr. Mike.
You can also, yes, and my number 0917-812-7797. I'm willing to answer all your questions. If you really need to go to China or not, if we can handle it here, then we will handle it here. And rest assured that we will give you the best options that we can give you. Okay, and we want you to understand your problem, but we will also be frank regarding your problem. We don't want to give you false hope regarding the treatment of cancer. You know, cancer treatment is sometimes very dangerous to predict. We cannot really predict the outcome of the cancer. Sometimes you are cancer free. They labeled you as cancer free, but after a year, the cancer recur. Okay, it depends on so many factors. At this point in time, there's no perfect treatment for cancer, but the development, the technology is fast moving. Okay, so mabilis po ang pamamaraan ng pag-develop ng pag-control natin and pag-treat natin sa cancer. Kaya po, tingnan natin po, baka sa susunod meron talaga tayong treat